recent investigations conducted by the Minnesota Department of Health found that 2 nursing homes in our area were negligent.
ABC 6 News reporter Maisie Olson is live in Austin tonight. Maisie, what can you tell us about these investigations?
James, Laura, I'm outside one of those nursing homes right now, St. Mark's Living here in Austin. The investigation found evidence of neglect by a nurse here. And one family that I spoke with that has loved ones inside says these findings have them scared and concerned. According to the report by MDH, a worker at St. Mark's found a resident unresponsive, not breathing, and without a pulse. When a nurse was notified, MDH says the nurse did not follow protocol and administer CPR, even though the resident's chart indicated to resuscitate in an emergency. Instead, the nurse decided it was too late and called police and the coroner. The resident died. Britnee Konken's grandmother, Bernice, currently lives at St. Mark's. She says these findings have her scared for her grandma.
It's really scary knowing that happened, especially if that were to happen to my grandma. And let's say it's on her chart that they can revive her, and they don't.
Her father, Daniel, says he's always had concerns with St. Mark's.
I mean, to me, that's like, okay, you're not paying attention to the residents.
The executive director of St. Mark's Living, Justin Bolt, wouldn't go on camera, but issued a statement to ABC 6 News, which says, quote, health and safety of our residents is always our top priority, and our team has completed enhanced training, revised policies, and conducted audits and drills. MDH also conducted a similar neglect investigation at Charterhouse Mayo Clinic Assisted Living in Rochester. The report states that a nurse failed to check on a resident whose health had been declining, even though reports given to the nurse from a coworker at the start of her shift indicated vitals must be checked regularly. That resident died during the night. Following a request for comment, Charterhouse issued a statement which reads in part, quote, leadership proactively reported the incident to the Minnesota Department of Health. The individual who was investigated is no longer employed at Charterhouse and is ineligible to be rehired.
When you're putting somebody into a nursing home, you know, you have to really pay attention to what's going on.
According to the Minnesota Department of Health, when cases involve a licensed individual, such as a nurse, that maltreatment is reported to a licensing board. Now, we know in the Charter case that the nurse was terminated, but in the case of St. Mary's, we do not know what action, if any, was taken against the nurse in this situation. Live in Austin, Maisie Olson, ABC 6 News.